Hello everyone and welcome to our Night Tech YouTube channel. My name is Michelly and today we'll be discussing, is telemedicine the future of healthcare? In this presentation we'll be covering what is telemedicine, its history that dates back to the 1800s, advantages, disadvantages, and its booming revenue in the stock market. Now, if you're still watching, please share and subscribe to our YouTube channel for more content. And don't forget to smash that like button. Now back to our presentation.
The novel coronavirus pandemic has stretched healthcare systems to the brink. COVID-19 might be getting all the headlines, but patients are still getting sick from other diseases and injuries, and that's left doctors looking for other ways to treat them while minimizing contact. Enter telemedicine. Telemedicine is broadly defined as the use of electronic communications and software to monitor and treat patients in lieu of an inpatient visit.
Here's some history on telemedicine. As you can see on the timeline, during the 1800s and 1900s, telegraph and radio were created, like Morse code and radio waves. Remember, this is how the Titanic communicated during their time. In the 1940s through the 1970s, the telephone and TV created, which the connectivity was called telephone network and TV analog transmission. Through the 1970s and 2000s, the computer was made, which we were able to use satellite and create internet. And from 2000 to 2020, computers and smartphones had advanced more, which broadband internet and cellular networks.
Telemedicine dates back to the mid-20th century, when radios were used to provide medical advice on ships. In hospitals, the first usage was in the 1950s, through a closed-circuit television link for psychiatric consultations. In the last 30 years, telemedicine treatment has expanded to mental health, stroke, and patients with chronic diseases like asthma, diabetes, or heart failure.
Now here are some advantages of telemedicine. Potential decrease on medication misuse, reduced travel costs and time visits to the office, or unnecessary emergency department visits. This telecommunication has been implemented as an efficient and cost-effective means of delivering and accessing quality healthcare services. Now that we talked about the advantages of telemedicine, let's talk about the disadvantages. Limitations with performing comprehensive physical examination, possibilities for technical difficulties, security breaches, and difficult to make a proper diagnosis on a patient. On the following video, we'll explain and break down what are some of the bigger disadvantages of telemedicine.
However, the practice hasn't been a perfect transition for all forms of care, especially for doctors who are used to seeing patients every day.
It's been disorienting to see so few patients in person. For a lot of doctors, this has been a learning experience, to put it mildly, because we are so used to having our priority list and how we take care of our patients dictated by who's on our schedule that day. And now we just don't have the same mechanism.
Another thing that has become very important in this tragic crisis are serious illness conversations with patients. Talking with patients and their families about their choices, and if they have chronic medical conditions, talking about whether or not they would want to be on a ventilator if their illness progressed rapidly due to COVID and they could not breathe. So again, many of the things that we used to take for granted would happen in person, we've now been forced to reinvent in this video-only environment.
Telemedicine has helped maintain some business for the healthcare industry, but volumes of visits are still down. that could hurt the system financially over the long term.
One of the primary care clinics where I work, it looks like our in-person visits have decreased probably by 80 to 90%. So they're at levels of 10 to 20% of what they previously were. And then our telehealth visits bring us back to our prior levels. So if we had before 100 visits a day, now we have maybe 20 in person and 50 to 60 telehealth visits.
The federal government, I think, needs to catch up on is that the way they have relaxed telemedicine regulations, they still don't pay really nearly enough for practices to make up for the lost volume that they're experiencing right now, because patients are really, they're staying home and visit volumes are plummeting across the country for practices everywhere, and it's especially hitting small and medium practices hard. And doctors aren't necessarily making up that volume with telemedicine, but also telemedicine visits only pay a third or even less of what a normal in-person visit would pay. So they're getting hit doubly hard.
Hospitals and other healthcare providers are slated to receive about $175 billion to make up for the increased costs and lost revenue as part of the Coronavirus Aid, Relief, and Economic Security Act. However, it might not be enough to save them.
This crisis has an enormous financial impact on hospitals. We've canceled all of the elective cases that are what helps support the mission of the hospital, and we are now caring for the sickest of the sick, and those patients are staying in the hospital for a very long time. And so without federal and state relief, this is an impossible burden for hospitals to carry financially. And we may be very much at risk of hospital bankruptcies because of the extraordinary concentration of needing to spend more money, acquire more supplies, care for the sickest of patients, and at the same time, no longer have the mainstay, the bread and butter of the procedures that largely fund the operations of the hospitals.
This is just some of the private companies that have invested in telemedicine.
Telehealth, a broader term used to define all medical services and health education delivered digitally, has grown steadily as an industry. According to IBIS World, the industry's revenue has grown 34.7% from 2014 to 2019. The market size in 2019 was around $45 billion, but it's projected to grow to more than $175 billion by 2026. Despite the increase in revenue, Americans have been slow to adopt the practice. According to a 2017 study, 82% of U.S. consumers don't use it. Like all of American life, that changed with the novel coronavirus.
The number of Medicare patients using telehealth has increased from roughly 11,000 a week to more than 650,000 people a week.
It's led to a surge in usage for telemedicine companies such as Teladoc and American Well, and video conferencing company Zoom, whose stock is up more than 150% since the start of 2020. Shares of Microsoft, which owns video conferencing software Skype and its Teams platform, are up more than 14% since the start of 2020. Telemedicine visits surged 50% in March and are on pace to reach 200 million by the end of 2020. That's up from earlier predictions of 36 million. America's healthcare system has skipped the test run and jumped to using telemedicine as a primary means of care during the coronavirus pandemic.
In conclusion, telemedicine can be beneficial to consumers, but also should not replace face-to-face office visits. Make sure that your insurance covers. Don't want to get that bill in the mail. And as always, stay safe.